It is 11:05. PinPoint Health Show is back, and welcome pinpointhealth.ca and anytime 1-855-55 Dr. Lou, DRLOU. The number has not changed, but the social media sure has. In fact, Dr. Lou, your social media guy is like literally walking behind you, setting stuff up. Look at this, like Hollywood in here.
Adam is amazing. Yes,
he's a good boy. Loud. Don't get the camera on me, man. Keep it off me.
Yeah, we don't need John on here.
The way these studio
he
lights
has a face
beam
for
off
radio.
my noggin. What's going on, buddy?
Not much, you?
Good, man. I'm all right.
Good
to be back. What's cooking?
Lots of stuff.
Good.
Lots of initiatives that we always keep going on with at the clinic. We're working on some big items for the new year.
Cool.
With some specialized services. We'll talk about that in the new year when it's time to do so. But as always, this hour is live, so we're happy to take calls on anybody's pain, injury, questions, whatever it is. Happy to answer any questions about healthcare. That's what we're here for. That's how it also works after the show, right? Just give me a call at the 1-855-55 Dr. Lou number, and then we can have a quick conversation about whatever the item is and, help you out in terms of pointing you in the right direction. There's times where you might have to come in, see me for an assessment. I obviously can't provide a diagnosis over the phone or over the radio, but I can definitely start to point you in the right direction. There's also been times when people have even called on the show and you just tell them that they're either doing the right thing or maybe they have to go back and see their family doctor. Maybe it's something out of the scope of what we deal with at PinPoint Health. But definitely I'm happy to have a conversation with anybody in terms of what my knowledge is and where I might be able to help out with the things that they got going on, for sure.
Again, always a live show here at 1107-416-870-6400 star 640 on cell. And I know we often talk about this off air, and it's obviously not just great for you, but it's great for everybody out there who's requiring that type of health care. Over the next several years, PinPoint Health is going to be such a major player, and this is really great for what you offer. Right?
Yeah.
You're going to be gray in like 2 years. You're so busy, but that's okay. It's going to benefit everybody, right?
Yeah, and we're really trying to drive an initiative here. We're trying to really grow quickly. As I've said hundreds of times on the show, I think there's a much better way to do this, to do the pain and injury management, and that's really what we're working towards. In fact, we have Paco here who does work with us on the physician engagement side. He probably doesn't want to say too much, but we were having a meeting where we're even working on research on adherence, right? So the example being is people are often referred for a lot of different services, but they don't follow through with those services. And we want to try to start collecting data on what the real numbers are, and then in terms of what can we be doing to change that. Because, again, it just comes down to prognosis. If you've been recommended to do something and you're not following through with it, then you're never going to get better. And then it's no surprise that these things go on and on forever. I was giving a continuing education course this week to a group of family doctors, and we were talking about how to best manage low back pain and family practices. And, we've gone through this quite a few times in terms of the waste that happens. But what a lot of the physicians were relaying back to me is that people often don't want to do the stuff that they're being recommended to do. And so the classic example is you go in, you have a new onset of low back pain, you go see your family doctor. Your family doctor's job is really to make sure that this is not something other than mechanical back pain, right? And that's what they're really there for in terms of if they determine this might be a referral from a certain organ or this might be something more serious, that's their job to start investigating. But we know that 95% of these types of issues are mechanical issues, which means it's related to the muscles, to the joints. Something is happening mechanically that's causing this low back pain. And so those people really most of the times in terms of best management from an initial perspective need the physical therapy, the chiropractic, the massage therapy, those things. So the doctor will then recommend, okay, I'm referring you to a clinic and, go get this care. And there's so many reasons why people don't follow through with that. And, one of the and there's some reasons that we can't control, but one of the reasons that I think that we really need to tackle is that when people just don't want to do it. Right? And so the problem is this person doesn't do those initiatives. They think just doing nothing will probably make them better. So they spend the next 2, 3, 4 weeks not doing anything, getting worse and worse and worse. They go back to the family doctor saying, I'm not getting any better. The doctor says, okay, well, have you gone for what I suggested? No, but now it seems so much worse. Okay, fine, let's send you for an x-ray, an ultrasound. just wasted
Just
money.
snowballs everywhere. Right?
Okay, let's send you for an MRI. Wasted money. Let's send you to a spine surgeon. Maybe it's surgical. No, most of the time, you don't need any of those things. The algorithms on this stuff and the research around it is very, very clear. It's not something that is consistently needed. Low-level imaging like X-ray often doesn't provide any benefit in the beginning. It might help if you're thinking there's a fracture of the spine. It'll be very good. But if this is something you're feeling low back pain in the absence of trauma, which means nothing really happened, you just woke up and there's no red flags. Red flags are things like severe unexplained night pain, maybe weight loss that's unexplained, severe night sweats, other weird symptoms, fevers, bumps.
Control, can't lose control of certain things,
losing
right?
controls, losing control of bowel bladder function is a very bad red flag. But if there's an absence of these types of things, which most of the times these things never occur, then what we're dealing with is mechanical issues. And you send somebody, the problem too with imaging is a radiologist's job when they look at an image is to tell you everything that's there. Okay. So you start reading through these images, and all of these things sound very scary, right? There's osteophytic formation at L4, L5. Yeah. There's arthrosis of the
fights, all kinds of. You're like, what the heck?
That's not a real. That's not a real thing, but it sounds like it could be
silliness. It's lupus. I mean, is it lupus? Is it lupus? Right.
So lupus is a serious thing, but all of these other things, these findings, osteophytes, facet arthrosis, antrolisthesis. There's a lot of big terms that when you go there, and this is what the physicians, the family doctors were asking me, they're like, how significant are these findings? They're not.
The word is, but that's it. Right?
It just sounds like a bad word. And then when you take all of those words and you clump it together, what do you call it? Degenerative disc disease.
Done.
Like, it's a disease. That does not sound good, but it's nothing. Right. It's really not that bad.
Just getting warmed up. Phone calls, they're open for you. Have health concerns of your own. That's why we're here for the hour. 416-870-6400, star 640 on cell. Bring it on. Pinpoint Health Show on Global News Radio. You bet it is almost 11:15 on your Saturday morning. The number's right, 416-870-6400, star 640 on cell. Your health concerns, bring them on. That's why we're here live on Saturday. PinPointHealth.ca and on social as well. I keep saying this, man, every week, but all the stuff you guys are putting up on social with Instagram and Facebook, the videos. I mean, I know a lot of this stuff from talking to you and doing the show for past 3 years, but it's so interesting to have a visual to go along with the explanation, right? Really good work. Good work.
Yeah, and I got to thank my team for sure with that, specifically Adam Wade up in our Newmarket clinic, our clinic director there, Dr. Wade. He's been amazing with videos that he's making, and he's going to be working on new ones. And that stuff has been a tremendous help for sure. And Adam, our social media guy who's here with us from the Reach Agency, has done a tremendous job really helping. I'm not good at this stuff like that.
I hear you.
Flat out, I'm being very, very honest. I'm not good with that, so definitely we required the help, but I think it's an important thing. I think if you're listening to the show, you should follow us. You can either follow my personal accounts, Dr. Lou, or follow Pinpoint Health, or follow both, and you'll get a bit of different content from both, but I think it's all very good content, and it's a benefit to you. Yep. So by all means, feel free to reach out via social as well.
416-870-6400, star 640 on cell. Deb, thanks for hanging on. Good morning. How are you?
I had better days, sir.
Okay.
How are you?
Good. Tell us about it. What's up?
Okay. Having problems with bone marrow extraction as well as a part of the bone. Suspected to have lymphoma. Been through the symptoms since, quite frankly, I was born from autoimmune disease that is undiagnosed. I have been through 27 specialists, and a year ago I had a massive piece of bone removed just from my pelvis hip. And when they extracted the marrow, none of it was any good. Now, when I say none of it was any good, it wasn't. They know there's something major. And this is a hematologist. It was linked with an oncologist up in South Lake, which is in
Newmarket. Yep.
But I'm having a terrible time here. I was born what they call a bubble kid. I was allergic to everything. Slowly but surely, my mom introduced me to everything. And as a result, I very rarely, if ever, get ill or react. Now, it seems as though I've had either non-Hodgkin's or a Hodgkin's fall in place while I've been growing. And I've not known about it other than swollen lymph nodes pre and post and during pubescence.
Okay.
Now, I had Dr. Wall, which was Elizabeth, if you remember Elizabeth Liu, that little beautiful Asian Chinese girl that needed blood way back in the day. And Joseph Wong of downtown, Village by La Grange, who takes care of the elderly Asian community. He actually started the database on Asian blood types because she needed that for the bone marrow transplant. Now, for me, it's literal flummoxed. White panel is always up, has been up since I was 14, 46 years old right now. I have recovered from a very serious stenosis, gone through the surgery in '08, and lost over 300 pounds from sitting in a wheelchair to becoming 127 pounds at almost 6 feet of lean muscle. And then, boom, I crash. And no matter what panel they do, and I've been to 27 specialists on my own, don't ask, but I do not know where to find the bone marrow. And if I could suggest something, I don't know.
So okay, number one, there's a lot of stuff going on, and I'm sorry to hear about everything that's been happening. So is your question essentially is what, in terms of...
Find the bone marrow.
Well, I mean...
What bone would I be able to find? That's usually the best spot.
Well, they often try to use the hip area, so either from the femur or the ilium, in order to get those samples. That's also where a lot of these cells are produced in these bigger bones. So, I mean, I would imagine that's where they used it. In terms of a diagnosis, it sounds like you've done a lot of the conventional things for diagnosis. I think a new area that is very up and coming, and the research around it is incredibly interesting for figuring out a diagnosis from a root cause perspective, is genetic testing.
Well, actually, it's funny you should say that. I've had genetic testing, and I'm looking, from my research, I'm looking at for lack of better words, a broken X chromosome.
Okay.
That could be possible. Yet there are so many. Like, I lived in Africa for a number of years. I've, et cetera, et cetera. I was born in the UK, came here. I got very, very, very ill with Dr. Joseph Wong. And where he gave me 3 weeks to live, within 2 weeks, there was almost no sign of illness in my body.
Okay.
So, this is what's happening. I am now on blood transfusions, and I'm desperate.
Yeah. So again, this is a very complicated case with a lot of comorbidities going on here. Also, not my specialty, not what PinPoint Health deals with, but I think this is an example where there's a lot of things going on, and there's new technologies to help with this stuff. The genetic testing is very, very important. Give me a call. There might be better genetic testing that we can do through different labs, and I can point you in that direction, but not something that I'll be personally dealing with. But definitely give me a call.
Deb, appreciate your time. That number, 1-855-55 Dr. Lou, DRLOU. Again, 1-855-55 DRLOU. Reach out for you as well. Plenty of time. 416-870-6400, star 640 on your cell. You got health concerns. That's why we're here. PinPoint Health Show, Global News Radio. It is 11:24 at PinPoint Health Show, pinpointhealth.ca, help at pinpoint or info at pinpointhealth.ca to reach out through email. Phone number, write it down, 1-855-55 Dr. Lou, DRLOU. But bring them on here. 416-870-6400, star 640 on cell.
Yeah, going back to, because we were running out of time for Deb, who's probably still listening. Again, this is not PinPoint Health and myself. We don't deal with these types of issues, as I mentioned at the beginning of the show, I'm happy to sort of give you some advice on things that could be done, but definitely look into genetic testing. And then once you can find sort of any genetic issue, there's also places and companies, which again, give me a call and I can refer you off to them, that will sort of help to tailor some treatment towards those things. A lot of these times, these very, very complicated cases, we're starting to figure out that this genetic testing actually starts to look at the root cause. Like there might just be something in the genome that is creating this that is very difficult to diagnose with the other conventional things that we have right now. So that would be my advice for Deb, is to focus on that potentially and continue working with the professionals that she's currently been working with. This is obviously a very complicated case, and there probably won't be an easy answer just based on the very little that I heard. But yeah, good luck with that, Deb.
It's the research keeps, and even in the fields that you cover, it's always growing. It's always
there's always better, new things that are happening, and in fact, the fact that we bring that up, it's interesting because in certain professions, in healthcare, there are certain members of those professions that don't want to advance. Okay, and I'm tippy-toeing around what I'm trying to say because I got to be careful with what I say. But I think, and this isn't towards the professionals, this is more for the public that listen to the show. I think when you're working with professionals and you're going to see a healthcare professional, it's to your advantage to work with people that are always looking for what the newest things available to us are. And if you've got someone and it feels like they're still focusing on some archaic thing that just because it started that way, it should stay that way, that's the wrong approach. Okay, there's definitely a progression. There's definitely new information that we have. And healthcare is always advancing. And I mean, be careful. That doesn't mean every single thing out there that's new works. That's why evidence is important. That's why scientific evidence is very, very important at looking at, what may work for one person. We need to do the right types of trials on it to see if it works as a population, right. The majority of the population, so that we can make it a recommendation. But, we can't recommend something and say that it's scientifically proven because it worked for one person or a group of a few people. There's ways to look at scientific evidence, and there's better research methods than others. And so some of the best research, and my goal always with this show is to inform people on what the best evidence-based, evidence-informed approach is, which is a combination of scientific evidence, scientific literature, clinician experience. So I don't take into consideration just my experience. I take into consideration the experience of everybody in my team that I speak with every day, that we work on cases together, and then also what the patient wants. That's a very important component of evidence-informed practice, that you need to be working within the realm of what the patient would like to do. And I think that process of evidence-informed healthcare is very, very important. And I don't think people should be fooled by things that are not working in that evidence-informed paradigm. I think it's very important for safety. It's very important just for efficacy in terms of getting the right things. So I encourage everybody, always make sure that whatever it is that you're getting, you're looking for what the scientific evidence is. And
Google Med School is never a good thing, like we always say, right? You got to be really careful.
No, and that might be part of the evidence-informed practice. Like, right. You can find very good research articles on Google, but there's a difference between proper scientific research and just a book that's been written by somebody. That you have to always consider what are the inherent biases. So you meet a lot of people that may have read a certain book and say that this is my ideology, or I've watched this documentary, so that's my ideology. I just follow that, because you have to sometimes step back and understand that those things have a bias. Obviously, this person is trying to sell this book. They're either trying to sell this documentary. Scientific evidence is something that is peer-reviewed. What that means is when we look at scientific evidence and we look at something, you publish it so that someone else can go do that similar research and see if you can keep finding the same findings.
Or at least try to disprove it.
Right. And
that's the goal.
Yeah, and that's the goal. And if you can't, then that starts to support the evidence, where you could say, okay, well, we continue to try. And then you can get into things like meta-analyses or systematic reviews, which look at all of the research that's ever been done on a certain topic and summarize it to say, okay, based on everything that we know, every piece of scientific literature on this specific item, we've been able to look at it and come up with the following. And some of those things, so when I was presenting this week to the group of family doctors, going back to low back pain, one of a big meta-analysis that was done was looking at what are the things that are supported by research for low back pain treatment and what are the things that are not supported by a lot of research. And it's very surprising because there's things like, for example, we've talked about this, education, reassurance, and knowledge are always supported by research to help with low back pain. So if people can have education on their issue, they can be reassured about it, and they can learn what to do and what not to do. Very, very good research around that. Exercise, rehabilitation, a strong core, great research for that. Things like spinal manipulation and soft tissue therapies, good research, especially in the acute phases. A little bit, it's still subacute, a little bit in the early chronic stages, but into the long chronic stages, so more than a year and a half, not very good research for it. Some things like passive modalities, like TENS machines or ultrasound, almost no research to support those interventions.
Really?
Yes. Muscle relaxants, gabapentin, not a lot of research.
Really?
NSAIDs, non-steroidal anti-inflammatories, and things like Tylenol. So Tylenol is not an NSAID, but Tylenol, its class of medication, and other NSAIDs, there is some support for that in the early stages. So this is important that we consider what are the best treatment options from a scientific standpoint.
We'll take a short one. Lots of time for you to call in here at 11:31. It is 416-870-6400, star 640 on cell. Pinpoint Health Show, Global News Radio. It's 11:33, Pinpoint Health Show. You'll want to reach out when we're not on the air as well. 1-855-55 Dr. Lou, DRLOU, and pinpointhealth.ca. Get to it, man. If you have any questions outside of the show, you want to see Dr. Lou, a member of his amazing team, as they continue to spread out and grow, please contact and get in touch. But for the remainder of this show, 416-870-6400, star 640 on cell. You know, before the break, we were talking about research and scientific-based stuff, and it's really... And I know you learned this way in college and university when you came through the medical field, but you still do it. You still do a ton of research. You want science-based stuff.
You have to be up to date with that stuff for sure. That's very important. And I always try to look at what are the new things that are coming out new, and I try to always be critical, right? Like I sit there and I don't just accept something. I really want to see both sides and start to understand.
Scientific.
Yeah, exactly. You have to be purely objective about it. And a lot of the problems is sometimes people are not objective about it because it benefits a certain interest of theirs. Okay. That's why Pinpoint Health, that's why I really love what I've built, because I don't have to try to just look for favorable scientific evidence for just one thing. There's so many different professionals, so many different interventions, that what we try to do is match up the right professional or intervention with the right diagnosis based on research evidence. And then there's no bias for me to say, well, you should go see this person or you should do this. Like, I'm not saying that everybody responds to the same intervention. What I'm saying is that depending on what's going on, you'll likely respond to a different intervention, but we can house it all under one corporate structure to get you what you need. And that's a very, very important thing. And just like, again, when we think about dogma, right? Like just accepted beliefs that maybe, so one of the things, and we were just talking about this, and this is an example because I'm not a cardiologist, so I'm not recommending this stuff, and I'm not telling you that if you are taking aspirin that you should stop. This is more of a conversation. But one of the things that from a dogma perspective that's been happening for a long time is a lot of people that are screened to be at risk factors for cardiovascular events like heart attack or stroke, based on family history, other things, are often told to take a baby aspirin as a preventative measure. There's actually been some recent research to suggest that it might help if you've already had a cardiovascular event and survived. So whether you've had a stroke or a heart attack, and then you take it as a preventative measure. Okay. There's some evidence there, but there's not very good evidence to suggest that if you haven't had those events, that it creates that prevention. So again, this is not me saying, I'm only using this example because it's probably very easy for people to relate to. People also know that this is like almost standard knowledge. A lot of people know about this type of preventative idea, but I think it's important to challenge dogma, things that are just have been accepted for so long, with new scientific evidence. Because if we're starting to get the new scientific evidence, then why not intervene in a much better way, right? And I think that's important. And then and research isn't just done on efficacy of treatment. It's done from a management standpoint. We started the show talking about the indications for imaging. Mm-hmm. There's also research about when imaging should happen, and those things should be followed. And if they're not followed, all we're doing is spending recklessly in our publicly funded system. That creates higher taxes. It creates, big inefficiencies.
You bet.
Deficiencies within the system. And it just creates a massive problem. So I think it's very, very important that when people listen to the show and they listen to me, that they really start to digest this idea of best scientific evidence and best practices. It's very, very important. And I want you all to find that place and find that professional that can help you with that. Doesn't need to be PinPoint Health. I don't care. There's a lot of good places out there, but just make sure that you're getting the right type of care and that you're getting the most up-to-date, evidence-informed care.
It's funny. I think it was a clinician one time said, that's why after all these decades, it's still called the theory of evolution. It's still a theory. We all believe it. That's how it happened.
Yeah.
But science still calls it a theory of evolution.
Yeah, and there's in the scientific world, the way things work is theories and laws are things that are proven.
Right.
Which once it's a law, it's like all of the scientific evidence suggest, like gravity.
Yep.
Gravity is a
it's
law.
hitting the ground.
It's that always happens. Then there's a lot of things that are based on theories, and some theories are stronger than other theories, right? So there might be a ton of scientific evidence to support something, but yet there's maybe some evidence that doesn't fully support it. And there's also, science has its limitations because not everything can be tested within that paradigm, right? Because the idea of, let's take, for example, spinal manipulation, so like a manipulation by a chiropractor.
Sure.
It's a harder thing to scientifically test because some of the best research is what we would call double-blinded, randomized controlled studies. What that means, the term double-blinded means that neither the person doing the intervention or receiving the intervention knows. So the example is if we take a pill, which it's much easier to do with a pill. Let's say we have a medication that we're testing for for cholesterol.
Sure.
The clinician doesn't need to know whether that's the real pill that they're testing or a sugar pill, and neither does the patient. So they just take it, and nobody knows what's happening. So because you don't know, it eliminates that bias of trying to, right? With manipulation, how do you ever give somebody a manipulation without them knowing?
Because they're manipulating them.
And how does the doctor not know what they're doing? They obviously would know. So that sham idea, which is what's like the sham or the placebo, is harder in certain instances to get. And that's why some interventions will say, well, there's not great scientific evidence. We say that because these studies don't exist. But the reality is some things can't be tested that way. So there's even limitations sometimes within science. And it's important to take those things into consideration. That's why when you critically appraise research, it's not just about critically appraising the final conclusion. It's also about criticizing the methods, the way it was done, who funded it. There's tons of things when it comes to like funding, like who's paying for the research, right? Do they have an interest in seeing beneficial research being published versus not so beneficial research being published? So there's lots of things that go into critiquing, and that's what people in the medical field, healthcare professionals are trained to do, is properly critique. And that's why, it's a dangerous thing when you meet people and they're just like, yeah, but I read this book and, it's based on science. It's like, yeah, but that book is it's a confirmation bias. They're looking for what they want to prove.
Right.
Now, it might very well be the truth. I'm not suggesting that it's not, but don't just accept everything. Challenge it, look for the alternatives, see what's there, and then come up to your own decision based on an evidence-informed practice.
It's amazing what you said about the daily aspirin, and you mentioned it could be the fact that the evidence is there because the people who take the aspirin are already had a heart problem. Okay, maybe I should get my nutrition in order now too.
Exactly, and there's a lot of confounding variables with that, for sure. Yep.
Well, I get to more. Lots of time for your phone calls. Bring them on. 416-870-6400, star 640 on cell. If you have any health concern, always want to get a baseline answer, get it started, call through the Pinpoint Health Show right here, Global News Radio. It is 11:42, Pinpoint Health Show, help at pinpointhealth.ca and 185. Damn it. You got to change it to help because it makes more sense.
It's a good one,
change
too.
It,
yeah,
right?
That's actually really smart.
Yeah. Info.
Not
info?
just the information.
Yeah, but help is it?
Help is nice.
You're a helpful guy.
You know what? I think you may have
changed.
Idea,
and you were here for it.
Yeah. You know what? We're going to give you You're our new marketing guy.
Thanks, great. But for now, info at pinpointhealth.ca and 1-855-55 Dr. Lou. That number has not changed. Keep it, write it down. Glenn, thanks for hanging on, fella. How are you? Good morning.
Not too bad, thanks.
Good, pal. What's on your mind?
Yes, I'm just wondering, will an ultrasound show that you have tumors in your bladder?
Would an ultrasound? Well, I mean, ultrasounds are a good initial diagnostic test that I think might show if there's something abnormal showing up. In terms of then it would require probably more specialized imaging and then probably biopsy if anything was there. So, I mean, an ultrasound will start to pick things up, but I don't think you could confirm a diagnosis of something like that. You'd have to do further testing, but it could definitely start to point you in a certain direction.
What about an X-ray?
No.
X-ray wouldn't, eh?
No, X-rays are very good for hard tissues like bones. They're not good for soft tissue. That's why X-ray is a gold standard, like if we're worried about a fracture. You could do, there are different X-rays that can be done with different types of dyes that you can look at the dye and those things. But I think with something like that, and again, I'm not a nephrologist or a urologist, so this is definitely not my area of expertise. But I think, that type of the worry about of a tumor or something would be based more on probably, I think CT scans would be a much better diagnostic imaging tool, followed by biopsy and obviously blood work and if there's clinical reasoning. Do you ask because you are concerned, or is it just an interest question?
It's I had some blood in my urine, okay?
Okay.
And this is a few years ago, and they gave me an ultrasound, and it showed that I had some tumors in my bladder.
Okay.
So I went to the specialist, and the first thing they do is they do a psychoscopic procedure.
Yep.
And then they tell you, oh, you got tumors in your bladder. Then they do a surgery on you. And every 3 months they want you to come back and do a psychoscopic procedure again. And I'm ended up now, I have to wear a urine bag.
Okay.
They have done me so much damage that it's just the urine goes on the outside of the tube now because they chewed away at my uterus tube where it enters the bladder. They enlarged it such that.
So I guess my question is, why do you ask? Like your question was, can an ultrasound show a tumor? What is there like a back end question? I'm confused. Obviously, the answer based on just what you said is yes.
Well, I had a ultrasound done, and the fellow that did the ultrasound said that I didn't have any tumors on my bladder.
But that's who, the technician or the radiologist? They're not diagnosticians, so the radiologist has to comment on those things, not the technicians.
But the biggest problem was that when I got the report back, someone had put a block on the when I had the test done, it was supposed to be all my lower abdomen. It was supposed to be all X-ray or ultrasound done on my bottom part, like on the abdomen.
Okay. Yep.
And it came back. Somebody has blocked out doing the ultrasound on my bladder.
Again, so I'm still confused. So where are we going with this? Like, is there a question? Well,
I'm just trying to get some information here because I'm getting railroaded because I've been doing this now for 3 years, going back and forth to the hospital and having an ultrasound, not an ultrasound, but a psychoscopic procedure, and then operations on top of that. And every time I went, I got worse.
Yeah, I mean, I can't comment on that. I'm not involved in that, so I think that's a conversation you have to have with the doctors that you're seeing.
Glenn, appreciate your time and appreciate the call. 416-870-6400 star 640 on cell. Plenty of time for you as well. David, thanks for hanging on. Good morning. How are you? Hi, David.
Merry Christmas.
Yeah, you as well. What's your question, my friend?
Okay, 20 years ago, I had surgery on my back. A technician, nobody could find the pain. Everybody said I was a liar. But this technician, he said, turn them a little bit, they turned me a little bit, and they found that the disc had blown out towards my stomach. And I've been in pain. They gave me 10 years, sorry. They gave me 10 years of pain-free. I could do whatever I wanted. Now the pain is back again, and the doctor I'm seeing doesn't like people with back problems. So my problem is, where do I go find another doctor that will help me, or should I just live with the pain?
Well, I mean, I think getting a second opinion is something. I think there's always more to these stories. You know, I'm hearing one-sided just from you. So, I mean, if you're unhappy with the information you're being given, I think a second opinion is always warranted. In terms of go back to your family doctor, get them to refer you to. So, are you talking about a specific surgeon that doesn't want to help you?
That too. The surgeon that did the surgery said I have a 50-50 chance, walking.
Right. So, I mean, that's, you know, and here's the thing. I think one of the problems is that people sometimes don't want to understand the reality. And a surgeon's job is to give you their best advice and make sure that you have the best outcomes. You know, 50-50, you know, if you're willing to take that risk. But, I mean, it's also, again, I don't know what your problem is, and so it's hard for me to comment accurately. I think what needs to happen is you need to look at what the problem is, determine if surgery is the solution. Surgery may not be the solution in this instance. Maybe it was when you had it back then. Maybe it's not now. Maybe there's other things. Maybe there's nothing. I don't know. But I think you have to sort of consider all of these things. And it's difficult for me, and when you hear these types of conversations, because I'm only seeing one side, or I'm hearing one side of the story. And I think it's people often, like I get this a lot, where people will call in and they're very pissed off, and they, you know, everyone's horrible, everyone's doing the wrong things. Nobody's out there to get you, okay? People in healthcare are not there because they want to do the wrong things to you. I think sometimes it's also about listening, and not just listening, but really understanding what someone is trying to say to you, right? I've had people that come in and I've told them, oh, you have low back pain, here's what you should do. You know, you need to build up core strength, you need to do this. And then they sit at the other end of my office and they say, so there's nothing I could do. It's like, well, I mean, I guess you're not listening, right? Like,
I just told you.
Yeah, I just told you what you can do. So I think the last two callers, I need to know more, number one. I can't comment on whether someone's wrong or not wrong without knowing the intrinsics, but there's always two sides to every story, I think.
Yeah, reaching out, by the way, when the show is not on, 1-855-55 Dr. Lou, DRLOU, and info at PinPointHealth.ca. Got it right that time. But for the remaining time here, give us a call, 416-870-6400, star 640 on cell, Pinpoint Health Show, Global News Radio. 11:54, a few minutes to go here on the Pinpoint Health Show, 416-870-6400, star 640 on cell. Want to thank you for your time of your day to call in and ask your questions. That's why we're here. Frank, thanks for hanging on. Good morning.
Well, thanks for taking me. I got a big problem here. It's I hope this doctor can give me a little bit of latitude. I have are you familiar with pruritus itching?
Yes. Yep.
Surface itching. Now, I've had this for a number of years, and I'm 73 years old now, and it's really bugging me. And strangely enough, it happens. I feel it more in the wintertime than I do in the summer. I had all kinds of doctors tell me you got to get your humidity up, moisture. But I feel, doctor, that this is coming in from the inside out.
Okay.
I get problems overnight, and it's itching in every different part of my body, now even at the top of my head, and I feel it's coming from the inside out. What do you got to say about this?
Well, I mean, so there's a lot of things. Number one, it sounds like you've probably tried a lot of the conventional things. This might be like a low-level autoimmune thing. I think there's been I've seen some cases of people that have had similar things that if you cut out a lot of, you're probably right about the outside in. I think if you do things like eliminating wheat and grain products, dairy, have you ever tried like a very, diet, like almost a keto diet, a lot more based on protein and vegetables, and that's it, and eliminating any type of wheat, grain, and dairy products?
Very interesting you say that, because I've been doing it. I've been trying my own.
It's cutting out.
We're cutting out, Frank. Give it to us again. You still there?
Yeah. Can you get me now?
That's better. Okay.
Yeah.
Go ahead.
Yeah.
So you have tried that or no?
I'm starting to do that on my own. I've been to doctors; they're all saying the same thing. That I went to an allergist. He take these pills to alleviate the itching. Didn't see any allergy whatsoever. So I'm really stuck on this. Now, can I get back to you in your office or not?
I mean, I don't deal with this stuff. I can set you up probably with one of our naturopaths, but I think trying that type of diet is probably a good thing.
So you say the wheat type? I always thought that was good for you.
Well, not for things that are autoimmune. The gluten, protein, and those things might affect those things. So it's
very interesting.
A lot of these things are trial and error. So a lot of times it's about eliminating things from your diet, seeing if you feel better. I know, like, an example is I don't know if you know who Jordan Peterson is. He's quite famous.
Just eats meat.
He eats meat because he had autoimmune issues and arthritic issues, and even his daughter, I believe.
Severe.
Yeah, and so all they did was go on just meat products, and they were able to control that. Now, I'm not recommending that for everyone. Right. There's probably a balance, and there is a benefit to eating vegetables and things like that. But I'm just saying, with these types of things, if the conventional stuff hasn't worked and nothing clear is showing up on diagnostic testing, then it might be related to lifestyle and diet. And so modifying that diet to those types of things could help.
Very interesting. You're the first guy of many that's brought me to Gordon. Is it Gordon or Jordan?
Jordan Peterson that we spoke of, yeah. What about him?
Yeah, I'm going to look that up. But I can go on. I'm going to carry on down the road you said, and I'm going to see what happens.
Okay.
Trial and error again. Thanks.
Good luck.
Thank you, Frank. Appreciate that, and we will catch you next week on the Carrasco Show. You will be calling in, I'm sure. Frank's a good man. So it's one thing you said before we go is they're not out to hurt you.
No,
right? Clinicians are not out to hurt you. They have no benefit from doing that.
Are there bad clinicians? Bad. Yeah, exactly. Are there bad bedside manner and things like that? But I think you always, how do I put this? It's not really, I'm never really concerned about the people that call and say, this one person did something wrong. That can happen. Mm-hmm. That I buy a lot more. When someone says, every single person I've ever seen, every single person in the healthcare industry is doing me wrong. Sounds like you might be the common denominator, and maybe it's something like, I don't think every single technician, every single nurse, every single doctor, every single receptionist, like that for us is what we call a yellow flag. A yellow flag is when you identify in somebody that there might be some psychosocial issues going on. And I remember one of my clinicians said to me once, be careful of the person who comes to see you and says, I'm here to see you, but no one else has ever helped me. Because
you ain't going to be no different.
That's a mindset.
Yeah, you bet.
That is a mindset. That's not just that everybody's out to do you wrong. It's a mindset, and that needs to change.
Done for another day. You want to reach out, 1-855-55 Dr. Lou, DRLOU, info@pinpointhealth.ca. We'll catch you next weekend right here on Global News Radio.